Hi, my name is Rachel Hall.
And I'm Scott Marine.
And I'm Ashley McDaniel.
We are fourth semester students, and we have just completed our community health nursing class, where we formed a partnership with Urban Ministry. Urban Ministry does crisis intervention, street outreach, and they also hand out snack bags to individuals who do not have enough food. We assisted them in handing out snack bags, and at that time we realized that for the weather we were having outside, which was about 20 degrees, they did not have adequate clothing. From there, we decided that it would be great to set up some form of donation system so that we could raise resources for these people. But before doing so, we created a winter weather survey to further assess the needs of the community. From there, we were able to collect donations and to disperse some of the donations.
Like she said, we noticed that there was a need for clothing during winter months for this population. So we went ahead and collected over 300 items of clothing to help with this need. But we also wanted to further investigate what were the needs that are arranged with winter weather preparedness. So we went ahead and created a winter weather survey, which went into data and domains such as housing, transportation, clothing, mental health, and safety to get a better understanding of what is going on with this population. Furthermore, we also wanted to get an educational pamphlet distributed so that way after the survey they would have something that they could continue to educate themselves with. This educational pamphlet also had contact numbers for Urban Ministry and other resources for them to use during winter months for winter weather preparedness. And the most beautiful part of this project is that this project has a lot of longevity to it. It can be continued to be used for future students and for Urban Ministry. And that's so essential in community health that we have a plan that can be utilized throughout the future and to better the lives of this population and others.
This project will thankfully be passed on to the next group to continue this process and interventions. We're very hopeful that these future groups will be able to pick up and continue with what we've left off. From a public health perspective, it's important that when we assess a need, we intervene at an early stage rather than waiting for the problem to complicate itself. And as future nurses, we took this into consideration by using primary intervention by way of the education pamphlet so that our clients will have a tangible resource. And then we use secondary intervention in order to create a holistic approach to addressing the individual's exact needs. This is important because in healthcare, as nurses, we need to be viewing more than just the medical side because we need to be socially aware of what we're sending our clients home to and what resources they'll have access to once they're out of our care.
My favorite part of our project was when we were able to go out to the street and actually hand out the donations that we took up. The people that we were working with were very thankful for the donations, and they emphasized how much it would help them with their needs.
And my favorite part of our project was getting to meet the people one-on-one and hearing their different stories and getting to put a face with those stories. It really helped put into perspective the many needs that are in our community.
For me, the best part of this project was obtaining situational awareness and becoming more aware of what's happening. Our care doesn't just stop at the hospital or wherever the nurse is. It will continue throughout that patient's care, whether it be through social work or getting them in a safe place to live or having them set up with food, because at the end of the day, what we don't want is them back in the hospital. So our care needs to be carried past the hospital and throughout the community.